Let's start with a quick poll. Raise your hand if you don't eat dairy like milk, yogurt, or cheese. Anyone? Okay. Raise your hand if you eat reduced fat dairy because you think the saturated fat is not healthy for the heart. Quite a few. And who here prefers regular fat dairy? Most of us. Okay. Saturated fat has given dairy a bad reputation. But the thing is, we don't eat nutrients like saturated fat alone. We eat whole foods. In fact, studies that tracked people's habits and health over a long time have showed that those who consumed more dairy, even regular fat dairies, do not have higher risk of heart diseases. Interestingly, we found that they have a lower risk of type 2 diabetes, a disease affecting nearly 4 million Canadians. However, these are observational studies, meaning that we can only say associations, but cannot say that it is the dairy that reduces diabetes risk. Many other factors, such as lifestyle, can also play a role. My research addresses this limitation through a controlled clinical trial where we directly test how dairy intake affects diabetes risk. So in this study, we recruited 60 middle-aged adults with pre-diabetes, meaning that their blood sugar level were above average, above normal, but lower than the diabetes cutoff. These individuals were randomly assigned to one of the three groups. So the first consumed no dairy, the second consumed 2 to 3 daily servings of reduced fat milk, yogurt, and cheese, and the third consumed 2 to 3 daily servings of regular fat milk and cheese. The intervention lasted for 3 months. During that, we asked participants to stay as usual, and we measured their weight, daily food intake, as well as physical activity. To assess their diabetes risk, we measured insulin sensitivity using the BEST test. So this tells us how well their body responds to insulin, a hormone that regulates blood sugar level. We also did a series of physical and blood tests to see their overall health. This includes blood pressure, blood sugar, inflammation, and blood cholesterol levels. We did all our tests twice, once before and once after the intervention, to see if the dairy really made any changes. So I'm currently analyzing my data to see if there are any differences among the 3 dairy groups. Once complete, my research would help clarify the role of dairy in diabetes prevention among high-risk population and hopefully inform dietary guidelines so that we can all move towards better health. Thank you.